A single act of good can go a long way. It can cross oceans, cure disease, and create equality. As members of Rotary, we are people of action, and our actions have the power to speak loud and clear. We're changing lives through our vision and unwavering commitment to fighting disease and bringing hope to those who need it most. Rotary's progress in polio eradication is an enduring example of our success. Building a global infrastructure and activating a network of volunteers capable of connecting the right people and inspiring action. Leveraging that success and the power of partnership, our global grants provide access to equipment, training, education, and vaccinations to ensure safe births and keeping kids healthy. Rotary Club members unite to create a world where our disease prevention and treatment programs aren't just changing lives, they're saving lives, providing surgeries and health assessments through practical and compassionate treatment. We're educating families and mobilizing communities to treat illnesses and prevent disease, engaging local health workers, and working with partners with expertise in cancer, heart disease, and diabetes care. Your contribution to the Rotary Foundation keeps families connected to a world of good. Every gift is an action that speaks volumes across clinics, communities, and continents. Learn how you can support the cause that means the most to you.
Following on from the historic moment in August 2020, when Africa was declared wild poliovirus free, we are very privileged to have past Rotary International Vice President Yinka Babalola to moderate our next session called Disease Prevention and Treatment. Yinka has received the Service Above Self Award, the Rotary Foundation Citation for Meritorious Service, and the Service Award for a Polio-Free World. He and his wife, Presi, are foundation benefactors and major donors, as well as members of the Archclump Society. Over to you, PRIP Yinka.
Let's be honest. In the face of the pandemic, the world has not had much good news to celebrate in global health this year. And the challenges ahead are formidable. That's why we must recognize the great achievement and commend all of the people who played important roles in reaching out this milestone. It took tremendous effort over many years.
Rotary and our partners began this mission more than 2 decades ago, when we joined with Nelson Mandela to begin the work of eradicating the wild polio virus in the Africa region. Mandela inspired us all, and his support for this effort energized African nations and leaders across the continent to step up their efforts to reach every child with polio vaccine.
And step up, we did. To all our Rotary members, thank you for your continued support and dedication. We know this hasn't been easy, and there is still work to be done before we can fulfill our promise of a polio-free world. But you have helped achieve something remarkable. Rotarians have raised funds for polio eradication, advocated with world governments and local and national leaders, held events and fundraisers for World Polio Day, and raised awareness of polio eradication.
From providing polio pluses, such as soap and health kits, along with oral polio vaccines in camps for internally displaced persons in Borno State, to giving polio immunization during family health days across Ghana, Nigeria, South Africa, and Uganda, Rotary members have shown resilience, persistence, and steadfast dedication to our top priority of ending polio. But we did not accomplish this alone. Tens of thousands of health workers have dedicated their lives to fighting polio throughout Africa. Thank you for your hard work. We have served as trusted voices in your communities and protected hundreds of millions of children from paralysis.
This is a big step in our journey to a polio-free world. But the fight is not over yet. We still need the support of our Rotary members, donors, and the heroic effort of healthcare workers to finish the job.
There's one more big celebration to come, when we eradicated wild polio for good. We need your energy, tenacity, and commitment to protect children worldwide and rid the world forever of this terrible virus.
Thank you.
Good afternoon, my fellow Rotarians, my dear friends, Rotary leaders around the world and across the continent, joining us in this celebration of 100 years of Rotary on the African continent. I welcome you to this segment on disease prevention and treatment, which is one of the 7 areas of focus of Rotary. We've been discussing the other areas of focus in the course of this celebration also. Disease prevention and treatment is very critical for Africa in particular. Listening to WHO, UNICEF, and other organizations involved in management of health, the statistics, the data available is that all of the negative indices seems to reflect on the African continent. For example, the number of children dying out of diarrhea, even our recent situation with polio eradication, with Ebola, and all sorts of illnesses, many of them preventable, that are plaguing us on the African continent. So we are glad that disease prevention and treatment is one of the things Rotarians on the African continent are focused on, and we'll be having some of those conversations today. Let me first introduce our speaker, Tunji Funshaw. Dr. Tunji Funshaw is the chair of the Nigerian National Polio Plus Committee. In fact, is credited mainly with leading the effort to get polio eradicated out of Nigeria. He is also a member of the Rotary's International Polio Plus Committee. Dr. Tunji Funshaw joins us from Nigeria, and it will be, in fact, no other person is more qualified to talk on the partnership between WHO and Rotary, particularly considering our recent success with eradicating polio. That was a partnership that worked. So welcome, Dr. Tunji Funshaw.
I'm delighted to be with you all, my Rotarian friends in Africa, around the world, on this momentous occasion of the celebration of 100 years of Rotary in Africa. Rotary has a long history of working with WHO that predates the Global Polio Eradication Initiative. WHO was present along with the Minister of Health of the Philippines when Rotary conducted its first polio immunization campaign in 1979. We continue to develop our relationship with both WHO as Rotary leaders develop the Polio Plus program. And in 1985, the Pan-American Health Organization, the regional arm of the WHO in the Americas, announced its goal of eradicating polio from that region in 1990. To further cement our relationship with WHO, then Rotary International President Carlos Canseco led the effort for Rotary to attain formal recognition as a consultant agency in 1985. Rotarians, especially in South America, worked closely with PAHO, and that became the model for working together in other 5 regions of the World Health Organization, including the African region. With the signing of the Yaoundé Declaration in 1996, when heads of Commonwealth governments vowed to eradicate polio from the African region, followed by the launch of the Keep Polio Out of Africa campaign by then President Nelson Mandela, Rotary and WHO began seriously working together to perfect and protect children from polio virus. The GPI partnership, including our partnership with WHO, works so well because each partner brings specific sets of skills to the effort. For example, WHO has the technical and policy expertise for global immunization programs, such as the Expanded Program on Immunization, EPI, launched at the 37th World Health Assembly in 1974. The goal of which was to make immunization against diphtheria, pertussis, tetanus, measles, tuberculosis, and polio available to all children by the year 1990. With the resolution to eradicate polio adopted at the 1988 World Health Assembly, work intensified between Rotary and WHO to eradicate polio, building on the experience of EPI. Rotary's strength, including managerial expertise, fundraising, advocacy, raising awareness, community mobilization, and volunteer engagements, complements the expertise of WHO in polio eradication and contributes to the overall health system's strengthening of the EPI. From the global to the regional to the country level, Rotary and WHO have worked together to deliver on Rotary's dream of a polio-free world. In addition, the infrastructure that Rotary, WHO, and other partners in the GPI have built for polio eradication has been utilized to respond to other disease outbreaks such as Ebola, yellow fever, SARS, and avian flu in the African region and beyond. And today, the collective experience of WHO and Rotary in polio eradication sets us up well to combat together the COVID-19 pandemic. For example, in Nigeria, Rotarians under the leadership of the National Polio Plus Committee are partnering with the government and WHO to support COVID-19 response, including vaccine introduction and delivery. Over many years, we have delivered a valuable partnership with WHO, building on our unique strengths, and we should continue to nurture this relationship to address other pressing health issues, such as COVID-19 and future disease outbreaks that threaten our community. Thank you very much.
Now let me present to you the moderator for the panel, Sue Paget. Sue he joins us from South Africa, and Sue is the chair of the Rotary Family Health Day. The Family Health Day is a program that has caught up very well on the continent and is well suited. In fact, it has helped us deliver a lot of our programs on disease prevention and treatment. I'm sure Sue will have a few things to tell us on the success of the Family Health Day program that has reached many people in various parts of the African continent. Welcome, Sue, as the moderator of this panel.
Rotary supports activities that reduce the causes and effects of disease. Projects strengthen the healthcare system by improving access to and expanding medical services, providing medical equipment, or training healthcare personnel. The unrelenting surveillance in the prevention, treatment, and control of communicable diseases in Africa. Good afternoon, everyone. It is a great honor to be moderating this session today. I am Rotarian Sue Paget from Cape Town, South Africa, and the current CEO of the Rotary Action Group for Family Health and AIDS Prevention. As Rotarians, we believe good health care is everyone's right. Yet, over 3.5 billion people, that is half the world's population, lacks access to basic health care. We know that many of these people live on our continent of Africa. Disease results in misery, pain, and poverty. That is why treating and preventing disease is so important to us. We set up temporary clinics, blood donation centers, and training facilities in underserved communities struggling with outbreaks and healthcare access. We design and build infrastructure that allow doctors, patients, and governments to work together. Our members combat diseases such as malaria, HIV and AIDS, Ebola, MS, diabetes, polio, and more. We also focus on health education and literacy, bringing people routine hearing, vision, and dental care. It is my pleasure to welcome and introduce our esteemed panel today, all of whom are experts in the areas of health on our continent. Past District Governor Mari Irene Richmond Ahua, an international communications consultant residing in Côte d'Ivoire. PDG Mari Irene has worked as an outreach advisor for the United Nations operations, served as Rotary's National Polio Plus Chair, and currently coordinates polio immunization activities in several West African countries. Our second panelist is PDG Ezra Tashomi, well known for his significant philanthropic work within Africa and in particular the impact of these efforts on children. Mr. Ezra is passionate about global health issues, particularly focusing on the eradication of polio and bringing clean water to the villages in rural Ethiopia. It is an honor to have you with us, Mr. Tashomi. Our third and final panelist from Botswana is Ms. Joy Pumapi, who is currently the Executive Secretary of the African Leaders Malaria Alliance, or ALMA. In addition to having served as a Member of Parliament in Botswana, holding the portfolio for health, she has served the World Health Organization as the Assistant Director General for Family and Community Health and has served as Vice President for Human Development at the World Bank. A warm welcome to Ms. Pumapi. As time is always short, I will begin by asking the first question to the panel. In remote peri-urban environments where basic education isn't up to a reasonable standard, we see disease running rampant. How can we improve health literacy around the continent? And what can academics, researchers do about this issue? Mari Irene, would you like to start this discussion?
Hello.
Well, I think that health education is absolutely essential if we want to reach the populations. It is important that the communities could be trained. Even the people who cannot read or write, they can be trained. So we could have a community template and we could mobilize the communities, which is a very important element. It's important to train the customary authorities, the religious leaders, and also to train the women's associations, the women's groups, the youth associations. For example, we could tell them that in order to recognize some signs of COVID-19, you can recognize somebody who coughs, somebody who has a fever. For example, you can train them with some practical examples. And you could lead them to collaborate with the nurses, for example, in the rural areas, in a way that when they detect and see some signs of a particular disease, they can straight away identify that particular disease, detect that disease in question, and therefore become a relay between the rural populations, for example, and the nurses in the community. But this training is essential. Information too. We need to teach people how to detect a particular disease, how to treat a particular disease also. We need to train them, we need to inform them with the relevant good communication, and we also need to prevent by offering some kits and materials.
Thank you so much. That is a very, very important question. As you yourself have said when you're introducing this panel, Rotarians play a critical role, but the most critical role that they play in health is at community level, working with the people. And this is exactly where the rubber hits the road and where the impact can be made on the live 215 million people who are being infected with malaria every day. And this is exactly what the 54 African heads of state and government are seeking to do by establishing anti-malaria councils in each country. And these anti-malaria councils pull together civil leaders, society leaders, they pull together politicians, they pull together leaders of different sectors, the private sector, traditional leaders, religious leaders. They pull them all together, young people and the elderly, to come together and agree on how to best implement the national strategy to fight against malaria. And when these people have an instrument, a tool that they can use to monitor progress, to measure it, and to be able to review the bottlenecks and assign responsibility for resolution, then a lot of good things happen. And this is where Rotarians are actually having a big impact in countries like Zambia, in countries like Uganda.
Ezra, what is your experience, especially in terms of your experience with polio eradication in Africa and how that aligns to the COVID-19 pandemic?
Yeah, thank you, Sue. The polio experience has given us, like Joy said, is to really, we have established clinics. We have established outstanding health workers who have been involved in the national immunization days and in giving vaccines to children. So we need to focus on how to utilize those people that we have trained, those places that we have built to help educate in the COVID-19. As you know, COVID-19 is really stranding everyone. I mean, even in America right now, we can't meet with people. Not everybody is vaccinated, and the vaccination is short. So I would see in Africa where COVID-19 could decimate the entire population, because in Africa, we're very close, families are close, friends are close, and that closeness, and in addition to lack of clean water and sanitation to wash hands, those kind of things are going to generate more disaster than in the other places. So Rotarians definitely could help in providing some of the needed PPEs and hopefully the vaccines as well. So we just need to really work together to attack the virus and also be able to make sure that all the PPEs that you need will be supported by the Rotarians from outside the country. So I would say that my experience in polio, Sue, is that the legacy will continue, and the outstanding health workers will educate, will go out and work, and they know the community, they know the area. So in that sense, we have done a wonderful job to really help and hopefully avoid the COVID-19 transmission without killing so many of our children.
Thank you, Ezra. It's very sobering indeed. PDG Mari, Irene, if you could finish off on this question and just have the last say.
We manage, as we know, in 2014, 2016, we have registered 11,000 people who lost their lives, 11,000 deaths from Ebola in West Africa, for example, in Sierra Leone, in West Nigeria, in Guinea. We suffered a lot of it. We suffered a lot from this in 2014, 2016. But we have admired the diligence with which not only the medical staff, but also the community got involved in detecting the Ebola cases, in taking them to the health center, how these people were then set aside and isolated in order to also make sure the population would be informed about it in order to avoid Ebola. So I'm coming back to how we can teach the populations and the peoples to be involved in the prevention of a disease. It's good to detect a disease, but we also need to train the population so that they will know that in order not to have Ebola, you will need to adopt this particular behavior or that particular behavior. So we're coming back to an awareness at the community level, which is that the parents at home, the women, the children, the custom authorities, the traditional authorities, the medical staff, and of course the private sector too, they can all also set in place a system that could be a national monitoring system, but an efficient national monitoring system with some tools and devices that will prove to be efficient. Also with people and human resources and people who are trained with some quality training. Of course, we also need to associate the laboratories. In fact, this is this whole all of this really with the staff, but also the political will. The political will must prevail in mobilizing people, and especially from the community. The community basis at the grassroots is very important. For Ebola, for example, we taught the populations to preserve and protect women and children who are more vulnerable. So the possibilities showed that when we really take care and behave accordingly, we can then prevent being hit by the disease. In 2014, 2016, it was Ebola. It led to many deaths, but there was an awareness. We did not just rely on the medical staff. Everybody got involved in order to prevent and identify people who showed some symptoms, in order to identify them, but also in order to present them to the health centers so that they could be isolated, and some measures were taken.
If we could move on. The next question: what is the consideration to using traditional methods in our efforts to disease prevention and treatment for many ailments that arise in the world?
Traditional medicine is really I would say, the genesis of modern medicine, because a lot of medications are derived from plants. And we know that our ancestors really relied on plants to heal us and to act as medication. In the area of malaria, for example, artemisinin was used, the plant was used in the East for many years, for centuries, in combating illnesses such as malaria. So that it is not a new thing. It's new perhaps in modern medicine, but not in traditional medicine. And in Uganda, for example, the Rotarian Malaria Partners have been planting mosquito repellent trees in the Karamoja region in order to help the community combat malaria. And in areas like Zambia, where the Rotarian have a long history of supporting health initiatives, including the support of polio, reproductive health, etc., they have supported the training and equipping of 501 community health workers. And some of these community health workers are actually traditional medicine men and women, or what they call sangomas in our region. And they have trained them on how to, because these are people whom the community trust. The community go to them first when they are experiencing any illness. So these are the people who are now equipped with the tools that can support the community. Because I think the most powerful traditional weapon really is probably not the medication, but it is the trust and the faith that people have in traditional healers. So we are capitalizing on this, and 501 community health workers in Zambia and in Uganda as well, community health workers, $1 million has been contributed by Rotarians in Uganda to train community health workers. And again, they are training the people from the communities, including the traditional healers. So I believe we are using, we have an opportunity to use our traditional healers, first of all, their strengths, but we should also remember that most of modern medicine comes from the traditional plants that we have used ourselves.
Thank you. We now move on to our penultimate question. Can you comment on the institutional preparedness of the health sector throughout the continent during threats of disease outbreaks and pandemics?
I think what has been absolutely clear with the COVID-19 pandemic is that we were not adequately prepared. But what is also surprising is that even those countries that actually followed the WHO guidelines and were international health regulations compliant, which regulations were actually developed to prepare countries for COVID, those were not able to cope with the pandemic well either. So it means there is still a lot that needs to be done to get us ready to actually be able to effectively combat pandemics. But one of the most important things that needs to be done is to ensure that we have robust primary healthcare systems that can withstand the shocks of these pandemics. And we have been talking today a lot about communities. And I strongly believe that community health workers are the key. And this is a community health workers that are trained, that work across disease lines and across the life force, and community health workers that are part of a formal cadre of health workers so that they are properly compensated and whose work is therefore recognized, and they are given the tools such as real-time data using information technology, even if it is cell phone technology, in order for them to be able to properly monitor what is happening in the community, and that are equipped with the basic tools, like rapid diagnosis tests for malaria, for HIV/AIDS, and the first line treatment for some of these conditions, even for pneumonia, which is a major killer amongst children. So I feel that we need to go back to the basics. And if the primary healthcare infrastructure is strong, then we will be able to withstand pandemics such as this. One of our biggest threats has been the slowness with which we're able to motivate behavioral change. Behavioral change has to happen at community level, it's a personal decision at family level. And the only people who have this interaction are people who are in the community. So the behavioral change is the key in a pandemic. We have learned this from Ebola. We have learned this from tuberculosis, from HIV/AIDS. We are learning it now from COVID-19. And those countries that were able to rapidly change behavior of their populations were actually able to recover faster and to control the pandemic faster. So I believe a strong message from this, a new normal. The new normal has to be a strong primary healthcare system that responds to the community and that is ever ready. And one important element, of course, I talked about community health workers, but it is data. And it is about real-time data that is going to inform decision-making and that is going to enable early detection of diseases. that we can control them.
Well, sadly, we've come to the end of our session. And just to close off, if I refer back to the topic of our session today, the unrelenting surveillance in the prevention, treatment, and control of communicable diseases in Africa. If I could ask each of the panelists to just do a summary takeaway from the session of points that we can hold on to as we end this session. And Joy, we'll start with you.
I think for me, the important takeaway is that data has to inform decision-making. We have to make sure that we have robust surveillance, monitoring, systems that are going to enable us to invest in the right areas and to detect diseases early and to be able to make the right decisions in controlling those diseases. And it also behoves us to invest in the community and to work with partners, robust partners such as Rotary International and the Rotarians around the continent that are already engaged in this area, but engage them more, make them part of the change, make sure that the success that we can get from investments in the end malaria councils and then malaria funds, in community scorecards and engagement, it belongs to everybody, because that is how we are going to build sustainability. So we have to develop a new normal. We have a huge opportunity now following COVID-19 to have a new normal where we make investments in the right areas. And I believe that this is where we should go. And I really believe Rotary is the right partner in the right place at the right time.
Thank you, Joy. Ezra.
Thank you, Sue. I believe the power of Rotary is amazing. The power of Rotary uniting people without the religious or tribal or other differences. And that capacity to really unite us, also being able to bring others from outside Africa to help us reach out and help those that need to help. I think invite people to join Rotary because there are so many that should join Rotary to help Africa, within Africa. So use Rotary, and within Rotary also the power of bringing other NGOs and organizations such as Bill and Melinda Gates Foundation, which is right here in Seattle. I work with them. And there are others like PATH, Rotarian Malaria Partners. All those organizations are willing to help, and we are willing to work with you. So let's create the partnership to really increase the capacity of what we could do to reach out in every corner of in every village.
Thank you, Ezra. And the final word to Mari Irene.
Health is an essential issue in Africa because health basically comes before development. African populations have to be in good health. They must benefit from good quality education and from healthy food and a healthy diet. They need a healthy diet. If health isn't there, we're going to have a hard time. It's going to be really hard to develop our countries. If our children are ill, they won't be able to go to school. And if they don't go to school, they won't be educated and they won't be able to take over in terms of developing our country. So it means that health really comes before development, is a condition to development, and it seems like a must it is a must in Africa to guarantee a healthy future to our children. And this is what Rotary has done with polio. Rotary gave a chance to all the children to be healthy. Because in the past, when children had polio, it was really serious and it was an obstacle to education. And you know that the parents in the villages, they were even hiding their children, the children who had polio. They didn't go to school, these children. And then, of course, they could not become educated adults and they could not participate actively to the development of their own country. So these children were really basically isolated, even though polio was contagious but differently. But malaria is not contagious, but malaria is also a big issue. And we must absolutely educate the populations so that they buy mosquito nets in order to protect themselves from malaria. And they protect themselves from malaria because malaria is deadly. It is a question of training, of information, it's a question of communication, but it's also a question of taking a position and engagement in the community. Today, the African continent is free from polio and children go to school. So, as you see, it is important. We must be aware.
So as we end the session, I'm inspired to have heard all our panelists today, and what I hear is great passion, great hope, great collaboration, and the future of a great continent. Thank you so much for giving of your time, and may we work with hands joined in the years to come. Thank you.
Thank you very much, Sue. Thank you very much, Tunji. Thank you very much for this panel discussion. I'm sure it has been very, very enriching and rewarding. The wish of us on the continent is that things that are preventable stops killing our children, stops killing our adults. Malaria, that is so endemic, there are things we can do about it. And all the other topics that our panelists have talked about. And let us leverage on the partnership that we know works and build partnerships everywhere, wherever possible, to make sure we can address the disease question, the disease issues on the African continent. And this is the appropriate time to now present to you, to let you listen, invite and listen to one of our biggest supporters as far as disease prevention and treatment on the African continent is concerned, and that is Mr. Bill Gates. Please listen to his message. Thank you very much.
To Rotarians from around the world, thank you for inspiring us and helping make incredible progress against polio. So many of you have been part of fundraising and vaccination efforts and called on your leaders to stay vigilant against this virus. Because of that, we're now on the verge of eradicating a human disease for the second time in history. But the final steps to a polio-free world are the hardest, so we need your help to get there, so no child will ever have to suffer from polio in the future. The Gates Foundation's long-standing partnership with Rotary has been vital to fighting polio. We need to keep that up. Together, we can make history. Together, we will end polio.
Good day, everyone, wherever you are all over the world. This is a special moment right now, and we are going to be recognizing people that are doing great in the world. Polio, as we all know, is one great challenge all over the world, and there are some people that have been working tirelessly for many years to ensuring that polio is kicked out of the world. Right here in Nigeria, a lot of people are working tirelessly, but people are leading this particular committee that is doing so greatly. And that's the more reason why we would like to recognize especially that committee, the Nigerian National Polio Plus Committee, that has worked tirelessly for ensuring that polio is kicked out of the country. Right now is the time for us to give special recognition and some awards to people that have led the committee, and in particular, the national chair of the Nigerian National Polio Plus Committee, Dr. Funshaw, who has led so many of his team members for many years, and today is the time. Of course, we have our past vice president, international, and that's Yinka. Yinka has also supported in ensuring that polio is kicked not only out of Nigeria, but all over the world. And this is the time for us to recognize them and present an award. This is a very special Paul Harris Fellows Award, which is given to them. The committee here has recognized them, and that is the reason why we would like to make this special award for them. Thank you.
And during the comfort break, you will listen to a reading of the presentation that Professor Martin Rupia was to have made in the peace section. This will be read by myself during the comfort break. So enjoy the break. Thank you. This is a paper presented by Professor Martin Rupia, Executive Director of the Dag Hammarskjöld Peace and Conflict Studies Institute in Zambia. Professor Rupia was meant to be part of the panel on peace building and conflict prevention, but unfortunately he's been unable to log in, and therefore we are reading his paper. This is a session on conflict prevention and the factors that lead to a healthy democracy. I want to defer to my chair, Emmanuel Katongole, in focusing on my topic, which attempts to isolate the factors and the stakeholders that then lead to a stable and functioning democracy. The underlying feature in the discussion is to acknowledge the fact that democracy continues to be work in progress. Democracy is complex. Democracy involves political, economic, socioeconomic, and security features, which together, when they are balanced, would then provide the platform through which a society can prosper and develop. So what are the factors that have been attributed in history towards creating a healthy democracy? Some of the factors that have been noted in the short history of democracy include the careful balancing of the political participation of actors that include the state, labor unions or organized labor, business and civil society groups, and others. Each of these represent an important dimension in what we call the formation or the consolidation of the African state. It is through the cooperation and the integrated work of these actors that one then finds the creation of a functioning political economy which speaks to and provides opportunities to the most vulnerable in a given country. It is also these factors that ultimately allow a state to function as an entity, but also to link and integrate itself both to the sub-region, to the continent, and to the global economy. Again, the creation or establishment of a healthy democracy is experimental, and many countries have had to learn how you allow and create space for the many actors to be able to make a contribution, such that the outcome ultimately is a functioning state, a healthy state, and an integrated society that is prosperous and is developing. The second question as I continue to defer to my chair, Emmanuel Katongole, and my other panelists, is to look at the following. What is the impact on African development in the event that we do not create healthy and functional democracy? Or stated differently, what is the impact and how can we change the paradigm? The first point is to acknowledge that in the majority of African states, history and experience have shown us that most have not been able to create healthy democracies. This is evident particularly in that the creation of democracies as we know them today only began for the African continent after the 1990s. Before then, one was confronted with the phenomenon of the one-party state system. To answer the question, the impact of the absence of a functional democracy is manifest in the political economy, in that the economy is not structured in a manner which provides opportunities for the populations as a whole. What one finds in many of the African countries that are in fact one-commodity economies is that there is a narrow elite that sits at the very top without providing space in participation for the rest of the majority. And the effect is that there is crisis and conflict because of a lack of resources within that country. Then that is expanded to the sub-regions and also to the continent, where the African Union has made it a point to suggest that African states must make it their responsibility to create a functioning democracy. The absence also of a healthy democracy is that there are no pillars to respond to disasters or to agricultural food security issues, or even to long-term planning, particularly around infrastructure. And so in conclusion, this discussion is important in that for conflict prevention, we need to take cognizance of the ability of allowing stakeholders to play a role. Otherwise, the alternative is where we have seen negative phenomena of internal strife and of conflict. I thank you.